Can I first of all welcome you all here today to the Long Gallery in Parliament Buildings. You guys have come up to the seat of power in Northern Ireland. Thank you for making your way here. I have a wee bit of housekeeping to do. If anyone needs the toilets, they're down the corridor to the right-hand side once you go by the Great Hall balcony. This event was to be held last year. This event was to be held in November. But because of the rules of the Assembly, I needed 3 sponsors, 3 MLAs. And we couldn't get MLAs to sign for this event. Because of the rules of this place and the divided community that we live in, I needed Unionists and Nationalists to sign for this event. I want to say a big thank you to my colleague Michelle McIlveen, who has been with me from the start, who was prepared to sponsor this event last October and November. But it has been a long year in trying to secure support from the nationalist side of the House. And that came to an end whenever I asked Michelle O'Neill, the First Minister, if she was truly a First Minister for all. Would she agree to meet with the vaccine injured and bereaved community? Because that's what you are. You're a community. And after a wee bit of to and froing and diary changing and everything, Fibs and I secured a meeting with the First Minister and the Deputy First Minister of Northern Ireland. And at that meeting, Michelle O'Neill, of all people, the First Minister of Northern Ireland, signed to sponsor this event. And that's why we're able to be here today. But I am glad that it took us a year, because now people can see what the vaccine injured and bereaved have had to live through when they have been ignored by government. Why have people who have been injured by medicine and bereaved by medicine, why have they been ignored? It seems to me the most natural thing that people would realise that with all medication comes side effects. Why have they been ignored? They have been ignored because a lot of people were coerced to take this medication due to government policies. And in particular, here in Northern Ireland, the vaccine certification scheme. That is what coerced people to take the vaccine, some against their will, and that is what discriminated against people. And there should never be a time when the state discriminates against people because of their medical history. It created a them and us society. People fell out with family. People felt isolated, alone. It's amazing how many people tap me on the shoulder, no matter where I was in Northern Ireland, and says, "Are you Paul Frew?" I would just like to say thank you. I was alone. I was isolated. I was fearful for the future, but you spoke for me. I still speak for you. I will continue to speak for you. But the difference now is this. It's been a lonely battle for many years, but now that we're meeting today, on the very day that the public health bill, public consultation ends, shows people out there the linkage between forcing and coercing people to take a medicine and the damage that it does. Everyone in this room is testament to that. And I thank you all for being here. I need to thank and acknowledge a lot of people here today. A lot of people who have been with me the whole way through. Fibs and I, first of all. Fibs and I are a very small body of people, volunteers, who put in tremendous work in trying to support the vaccine injured and bereaved. We have sessions, we have visitations, we have people coming together to demonstrate support and to show that they're not alone. We also have a campaigning arm that fights for better pathways of care, that fights for a reform of the the vaccine compensation scheme, as I call it, the payment scheme, the UK-wide one, which needs to be radically changed. It's not good enough that you must prove that you've been disabled 60% in order to get a one-off payment of £120,000. That's not good enough. What if you're 59% disabled? What if you're 50% disabled? What if you've lost your job? What if you've lost your livelihood? What if you've lost a family member? It's not good enough, and the government in Westminster needs to do more to help and assist people who have been damaged by this medicine. I want to thank FIBS-NI for being with me through this journey and for supporting so many people that I couldn't support. FIBS-NI gives you people that voice. I also want to thank all the medical professionals who have travelled here today and who will speak today, and some who won't be able to speak today. I thank you for your bravery in speaking out, because you have a lot to lose, and some of you have lost a lot. I thank you for that commitment. I thank you that you have not let your ethical stance down and that you've kept the faith with regards to medicine. I thank you for it, and all of those doctors need a round of applause. But most of all, I want to thank every single person in this room today, and all those who couldn't make it because of illness, that have been vaccine damaged and bereaved. We are here for you. We're all here for you. And the one thing you must know as you leave this room is the strapline that FIBS-NI bases all their principles on, and that is, you're not alone. The Department of Health would have you think that you are alone. The Department of Health would like you to think that you have rare symptoms, that you're the first we've seen of this kind. That is not true. There are many. There are many who have been vaccine injured and bereaved. The yellow card scheme is only a small part of it. And look at the numbers of reports in that. How many? I just don't know. Maybe someday we will know the full scale of this and we will know the truth. The truth has had a battering over the last 4 years, but it's making a comeback, and it's making a comeback today. Thank you very much.
So part of the work that what VIBs do, which Paul has pretty much covered quite well, is we offer people the support. We also have a campaign arm, which is the political end, where we try to get people the better compensation scheme. The other part of that is we have Ken and Sharon here, who've also been affected directly by the COVID vaccine programme. And they open their home up and give support to those people who need it, just a listening ear, just a voice. But it's a shame that as we stand in here today, that they've no pathway to care. And that's what we're trying to do today, is to attempt to push our politicians into eventually taking note and to stop ignoring people, gaslighting people, and trying to sweep these vaccine injuries under the carpet. So look, that's pretty much all I need to do at this stage. I'm going to pass over to the next speaker, which I believe is Paul Brady. But if anyone has anything they need from any of the VIBS team, please do raise your hand and we will try to get to you as soon as possible. Thank you very much, everyone.
Okay, thank you, folks. I'm not much of a public speaker, please bear with me. I'd just like to say, first of all, my first Pfizer, whenever I got it, it didn't really do anything. Sore arm, no problems with it, but my second one was a slightly different story. So, where are we? I got my second vaccination on the 22nd of August 21. At the time, I just asked if I'd be able to go to the gym and carry on as normal, and they said yes, 100%. But during the week after that, I experienced sudden pain and palpitations in my chest. These were quite fleeting and did not cause me any worry. At the time, as I was told, some side effects could present themselves, but they would pass quickly in a few days. On Monday the 30th, I'd been at work and went to the gym afterwards, came home and I was sitting watching TV with my partner, and I started to feel really unwell. I felt lightheaded, and I'd had a pain in my neck that went up across my head and numbness in my face. I immediately went upstairs and vomited and lay down on the bed. My partner came up and said I had heart palpitations, shortness of breath, chest pain, but on a far larger scale than I had previously experienced. I was quite panicked, but I put it down to some muscle strain from the gym, and I went to sleep. When I woke up, I felt absolutely awful. I had still some movement in my arm, although it was slightly numb. I attended hospital a couple of days later. I still didn't feel okay, and they ran a battery of tests on me, including a brain CT scan and the neck as well, both with and without dye in my blood. They said they were normal and no sign of a clot, so it could be a migraine. I've never experienced a migraine before in my life. Suspected I may have had a mini stroke, but nothing showed on the scan, so I just followed up with my GP. It should be noted at this point that I struggled through the work and didn't phone in sick. So a while later on Friday, the 3rd of September 21, I got a GP appointment and told them what had happened, and they just said, look, anything else happens, go and report to A&E again. So I continued to attend work, and then on the 7th of September 21, I'd felt terrible all day with a pressure building in my head, lightheadedness, and along with chest cramping. I finished my shift and went home and just about got in through the front door and passed out. When I awoke, my resting heart rate was near 200 beats a minute, and I phoned for an ambulance. My chest was in agony, my breathing was laboured, and I could barely speak a word without having to pause. The people on the other end of the phone said they thought I'd had a heart attack. I had to open up the front door, turn on all the lights inside the house, lock away pets, and crunch 300 milligrams of aspirin between my teeth and lie on the floor. So I went to the RVH in the ambulance and spent the night there, and got out there the following afternoon after having a load of tests done. They said that whatever had happened hadn't caused any lasting damage to my heart. They could detect no dead heart cells in my blood. My troponin wasn't raised, but something had definitely happened, and if anything, I had to go back to my GP or go back to A&E again. So that was just the start of it. On Wednesday the 22nd of September, I was back in A&E again in the middle of the night with severe chest pain, shortness of breath and heart palpitations. I was kept overnight again and had the same test repeated as last time, and went home none the wiser the next day. At this point, I was fed up with being fobbed off by the staff in my GP's front desk and phoned on Thursday to complain, as I've been trying daily to get an appointment, but as we all know, it was impossible during those days. I was phoned back that day by a doctor who did give me an appointment. So I filled him in on what had happened, and again, he just said if anything else continues to happen, go back to A&E, which I did do. I was in A&E, I believe, 6 times over a 3-month period. With similar symptoms. They still persist to this day. I would get quite dizzy and confused. I would get chest pain, lightheadedness. I'll sometimes forget what I'm saying in the middle of a sentence. If I'm on my feet for too long, my hands and feet will swell up. It's been absolutely horrible, and I can feel it starting to come on. Sometimes my heart, if I'm up doing something, walking about in work, say, and my heart rate's maybe 110 beats a minute because I'm doing something, it'll just suddenly drop to 40, and then I have to get on the floor because I'm going to collapse. I would also get lightheadedness, blurry vision, extreme fatigue. That's what I'm experiencing sort of now. It's not on a daily basis anymore. I have improved slightly over the intervening years, but it's horrible to go through, and people aren't listening. I had my last appointment with my cardiologist was last August, and I was supposed to have another one there August past, and I'm yet to hear from them. I was having issues getting seen by different clinics to rule other things out. Those have been ruled out, and phone calls to the secretary of the cardiologist have done absolutely nothing. I just can't get an appointment. I've actually got another medical professional to write to the cardiologist in the RVH saying, could this man please be seen because he's in distress. It's been a hard road. It never should have happened to me or anyone else, and believe me when I say that I'm one of the lucky ones, because I'm here on my own 2 feet and I'm alive, and some people affected by this are not. Sadly, as we all know, we were hammered with the phrases safe and effective and all the stuff in the news. That's what I get. If I try and tell anyone about what happened to me, I get that quoted back at me because it's just been programmed into people's heads. It's all they can say. They're just automatons just repeating the phrase back at me again. What I got, I'm aware that it is a minority. It's not quite the minority that leads you to believe, but this has happened to a lot of people, and it should never have happened to anyone. It absolutely, it's abhorrent, to be entirely honest, that the medical professionals pushed us towards this. Even the people in this very building put out the messaging that it was safe and effective, and that is not my experience, and I've been left damaged because of it. It's sadly, pardon me, I was put on limited duties by the OHS, and I have a government job. The OHS I have to be re-reviewed, but in the meantime, my job are trying to force me back onto full duties, even though I'm not fit to do it. So I've been, I was led up the garden path by the medical professionals. It's hard to get speaking to anybody about it now. No one seems to take it seriously because of what happened to me, and it's not right. I think that's all I have to say, to be honest. Thank you.
Thank you very much, Paul. That was excellent to hear from you directly. Next up, we have Jamie Williams, and I believe your neurologist is also here, and I'd like to hear from you. So if you're available, please come to the front. Thank you very much.
Thank you. I'd like to just speak about my experience. I went into the pandemic as a registered nurse. I worked in COVID respiratory during the pandemic. Within Northern Ireland, I was handed PPE to look after patients that had expired 20 years previously. We were going in to an illness that we knew nothing about. During the pandemic, I was then asked, probably on a number of occasions by my employer, to have my vaccine. The NHS within England had mandated vaccination, and if we were not vaccinated, we would lose our jobs. That combined with having PPE that was 20 years, 2 decades out of date, I felt that I had little choice but to have my vaccination. I had my first vaccination in January 2021. I felt fine afterwards, didn't even have a sore arm. It was as if I hadn't had a vaccination. I had my second vaccination on Easter Sunday in 2021, whilst working a 13-hour day. I went home from my shift and I felt generally unwell. Went to bed that evening, and the following morning, so Easter Monday, woke up and had flu-like symptoms. My flu-like symptoms persisted until the Wednesday, and I woke up in bed and I felt slightly better. That was until I tried to get out of bed. As soon as I stood up, I could feel my heart racing. I had palpitations and I felt really dizzy. I immediately lay down because I felt like I was about to faint. I tried to stand up again and I repeated this process 4 to 5 times. I measured my heart rate on standing and it was between 180 to 200 beats per minute. When I was lying flat, it was 50. Prior to the pandemic, I used to run. I used to play rugby. I was fit. I was well. And that changed overnight. I was referred to ED because they believed that I had a blood clot. I had my bloods done in ED and was seen by a registrar who really didn't want to be there. He didn't want to listen to me. I was told that I had an inflammatory tachycardia. For the medical professionals in the room, you'll be aware that inflammatory tachycardia is there no matter what your posture is. Mine was just on standing. I asked the question 4 to 5 times and questioned the diagnosis. I was sent home. When I asked him when this would settle, when it would subside, I was told 7 to 10 days. I spent 10 days at home, unable to stand up. I was able to lift cereal, milk and a bowl and sit on the sofa and pretty much lived there for the 10 days. After the 10 days, I booked an appointment with my GP. My GP assessed me face to face, which I was quite fortunate during the pandemic. On standing in his practice, my heart rate was 160 to 200 beats per minute. I was told that I would be seen by cardiology the same week and an urgent referral was put through. I wasn't seen for 6 weeks. During that period, I was fortunate that, I seen cardiology in the Ulster Hospital. My experience was less than satisfactory. It was atrocious. I was fortunate then to be taken over by a cardiologist in another health trust who seen me and listened. 3 months had passed at this stage. I was still the same. I wasn't able to stand, wasn't able to walk. And given my baseline before, I was working 13-hour shifts and doing 4 and 5 a week because we were in the middle of a pandemic. 12 months had passed, and despite trying multiple medications, I had surgery to try and carry out an ablation on my heart, which was unsuccessful. I then wrote a complaint to the health minister. I'm still waiting a response from him. I had a pretty much automatically generated letter that came out and referred it to the 2 health trusts involved in my care. I was fortunate that one of the health trusts and my consultant fought for me, and I was lucky enough to go and see a consultant in England who understood my condition. When I went to see the consultant in England, he started me on IV infusions. I used to attend outpatients at hospital several times a week for infusions. Again, I'm really fortunate to have a consultant that listens to me and that I'm heard. During that process, I was off work for in excess of 13 months. I was seen by occupational health. I was told that my likelihood of returning to work was pretty much 0. Their decision at that point was that I should go down the route of medical retirement. I was 27 years old. I argued and argued and argued and advocated for myself countless times when it felt like nobody else would. I asked the question of, why can't you put me somewhere? I'm 27, I still have a purpose. I was moved to an outpatients department, which was not where I seen my clinical practice. I used to have to leave work several times during that week. It took me, I think, 6 months to get up to 30 hours per week. I then would have left work, travelled to another hospital and had my infusions there. Again, I've been fortunate and have a fantastic consultant. I now have a central line that's placed in my arm. I carry out my infusions at home several times a week. In a day, I've just counted up my medications sitting here. It involves up to 37 tablets in the space of 24 hours. I was fit and well before. I had an issue with my central line at the weekend. I was contacted by telephone by a GP out of ours. One sentence that he said to me was that I needed to take some responsibility for my own health care. I have returned to work. I've actually moved countries so I can work in clinical practice. I work as an IV therapy nurse in a home care setting. The only reason that I can do my job is because 99% of it is sitting down. I have a blue badge that allows me to sit or park my car at the front of my patient's houses. I struggle then to get inside with my equipment, but I'm able to sit down to carry out the role. Many of my patients have noticed the fact that I too have a central line. I'm there as a nurse to look after those patient central lines and administer infusions in the same nature. I suppose I've learned over the course of my injury to advocate for my patients and fight for them when nobody else will, but still it feels like nobody else will support me. I applied through the VDPS process. At this point, I was not able to work. Unfortunately, my reaction to the vaccine isn't listed in the Green Book of Side Effects. I would ask you who writes that and who updates that. When you look at the statistics across the UK, there is a huge number of case studies where individuals, it's actually across the world, have damage to their autonomic nervous system secondary to vaccination, yet that is still not listed. I don't really know. I'm now 31. This is essentially nearly 4 years on. We're no further forward. I'm concerned what my life will look like when I'm 50, when I'm 60, when I'm 70. I travelled here yesterday to speak at this event. It involved me using a mobility scooter to get through the airport. I brought my bag, and then there's a rucksack that goes everywhere with me. In there is my infusion pump and my medications, and that is just for 3 days. I just don't really know where we go from here. I don't know what my life looks like. My partner has become my carer. And again, without that support, I really don't know where I would be. And that's even in terms of the likes of managing medications, managing infusions. I'm just lost. But I think my favourite line is the Green Book. The reaction that I had was not caused by the COVID vaccination. Thank you for your time.
Thank you very much, Jamie. That was very powerful. I'm sure everyone's learnt a lot from hearing your account. Next up, we actually have Larry Lowe here, who's been severely affected, but he's not. He is here in the front row, but he's not going to be able to speak from the front. But we do have Virginia Lowe, who will speak on his behalf and be able to say a bit more. So, welcome, Virginia.
Good afternoon, everybody. Thank you for the opportunity to speak today about this extremely important issue. I want to thank Paul Frew and the VIBS team for getting us here today and allowing the vaccine injured to have a voice. We are very grateful. My name is Virginia Lowe, and I have travelled here from Omagh along with my husband to share his vaccine story. Larry's condition makes it very, very painful to speak for long periods of time, so I'm his voice today. I don't actually know how long he's able to stay here. He's sitting in the front row taking multiple attacks as I speak. He's shaking, stimming with the pain to try and keep it under control. Prior to December 2021, my husband Larry was a healthy, active man with no health concerns or underlying conditions. He was a college lecturer and a successful musician, but that was all taken away from him on the 15th of December 2021. That was the day he received a COVID Pfizer booster injection in Oma Leisure Centre. Within 2 days of this, he complained about unusual painful facial numbness with further pain in his teeth and his gums. This was only the start of his onset neurological journey. I must point out that at that stage, we did not for 1 minute connect the injection with these symptoms at that time. We had placed our trust in the scientists that the COVID vaccine was safe and that we were doing the right thing to protect our loved ones. In early January 22, Larry was rushed to hospital with a suspected stroke. However, following hours of intensive investigations and a CT scan, he was primarily diagnosed with a severely painful condition known as trigeminal neuralgia. This condition is one of the most painful conditions known to mankind and nicknamed the suicide disease. At this point, he was prescribed the first of a long list of anticonvulsant medication and booked in for his first MRI scan. By February 22, my husband's condition and general health had really deteriorated. He was plagued with endless, random, electric shock-like facial attacks, constant cranial pain, and severe sensitivity to light and temperature changes. Very little sets off these extreme electric shock. Example, brushing your teeth, sudden movements, loud noises, shaving, eating, moving his head, talking, walking, and sometimes for absolutely no reason at all. In addition to the excruciating pain, he was also losing all feeling in the right-hand side of his face. He now wears dark glasses and a ski mask wherever he goes, inside and out, as the change in temperature or wind causes increased chronic pain and an onset of attacks. In March 22, Larry could no longer keep working as the pain was too intense and he was put off sick by his GP. He has never been back. We were very lucky, although lucky does not fit the world of pain that he's in, but lucky that his GP was very sympathetic to what he was going through. He referred him to a neurologist, but this was going to take years on the NHS, so we had to get an initial appointment to go privately in March 22. Larry met with a private consultant here in Northern Ireland, consultant neurologist. His initial diagnosis with him was also trigeminal neuralgia, and this began the process of prescribing very high doses of anticonvulsants such as carbamazepine, baclofen, lamotrigine, amitriptyline, gabapentin, pregabalin, phenytoin, to name a few. The sheer volume and high strength of the medication made Larry feel even worse. Over the following weeks and months, Larry endured increased medication, multiple MRI and CT scans, nerve block injections, lumbar puncture, full body PET scan, nerve testing and maxillofacial investigations. Larry was eventually admitted as an emergency to South West Acute Hospital in Enniskillen as his sodium levels dropped to 121, which was considered to be a life-threatening condition. This is called severe hyponatremia. In addition, his liver function and blood infection and thyroid tests were all abnormal. This was all a side effect of the high dose of the medication. They were not having any effect on his condition, and they were only making him worse. As time moved on, the crippling electric shock attacks were now firmly on both sides of his face. The pain was completely crushing and debilitating for Larry. One side is bad enough, but both sides are extremely unbearable. It had also spread to his scalp. He described that even his hair felt painful on his head. Larry's bilateral pain on both sides baffled the medical professionals, as this was very rare. Typical trigeminal neuralgia usually only presents one symptom, either constant pain, electric shock attacks, but not both, and certainly not accompanied with numbness. His consultant neurologist had exhausted all investigations available to him and realised that this was something more. Larry's condition seemed to be mimicking trigeminal neuralgia, but was something much worse, and he was re-diagnosed with a thing called painful sensory trigeminal neuropathy, which is much harder to treat. The consultant reached out to one of the top facial pain specialists at the Pain Management Clinic in St Thomas's in London. It took months of waiting for financial approval to send Larry there, but we eventually had a face-to-face appointment with them on the 4th of April 2023, 16 months after the first symptoms. In London, we were met by a multidisciplinary team of neurologists, neurosurgeons, doctors and senior nursing staff. Following an account of Larry's journey, the senior neurosurgeon simply confirmed that Larry's unique and refractory illness was, in their collective opinion, and I quote, as a direct result of the Pfizer vaccine. We both broke down as we couldn't believe this was real and that they were so certain. So we asked him, was he sure about this? And he simply said, 100%. They confirmed that due to the timeline from receiving the COVID-19 booster vaccine and the onset of the symptoms, that it was 100% an injury to the trigeminal nerve caused from the booster COVID-19 vaccine. They stated that the nerve damage was so significant that a major trauma would have had to have happened, for example, a car crash or a toxin. Larry did not have a major trauma, but did receive a toxin. They also confirmed that this was the worst case that they had seen and that they were seeing a huge dramatic increase of neurological conditions following the COVID-19 vaccine. The end plan was to perform neuromodulation surgery, but this was only an option when everything else was exhausted. It involves implanting a neuromodulation device into Larry's spine in order to address his chronic and worsening facial pains. We held on to hope that if all else failed, then at least we would have an option of surgery. It was emphasised that this was still not approved through the NHS and was considered experimental, but they would discuss the risks of applying for funding to the NHS. They were hopeful that this would be approved, as it was the government's advice to get the vaccine that caused the injury and disability to him. Larry took a number of severe attacks in front of the panel. In November 23, Larry started to feel pain in his back, arms and legs. This was devastating, as we knew that this wasn't muscular and it was the same severe nerve pain in his face. How on earth could he endure more pain? At this stage, he had been through so much. It's just unbelievable that someone has to suffer in constant, debilitating pain day and night. His consultant suspected a condition called small fibre neuropathy. This was in addition to the diagnosis of trigeminal neuropathy and severe photophobia. It just kept getting worse, and so hard to take in the severity of what was happening to him. The 15th of December 21 and now the 8th of February 24 are two dates imprinted into our minds that we will never forget to the day we die. The first date took the COVID-19 vaccine, and the second date, the 8th of February 24 this year, was the date the consultant neurologist phoned us from St Thomas's Hospital. We naively thought this was to discuss the last option to perform the neuromodulation surgery. We were terrified at the thought of spinal surgery, but at least we had hope and there was something that could help him. The consultant came on the phone and spoke the words, "I am sorry, but the multidisciplinary team will not perform the surgery, as the pain is now spread to the rest of his body." They deemed it too risky, where they could either leave him in a wheelchair or even make the pain worse, although I don't know how that could be possible. We froze. We were in complete shock. I felt like I had just been hit by a truck and was sick to my stomach. We were broken. We had lived in hope all this time that at least there was something they could do. There was a plan. He could have some sort of normal life again. I felt like just lying on the floor and never getting up again. I was the strong one up until then. I had to keep it together for Larry. He is the one suffering in pain. I had to live in hope, and that was taken away from us that day. I couldn't function then. I couldn't work. I was off for months after that, and only now very slowly picking up the pieces again. But I have no choice. I have to go on. I have to fight. I need to help him. My husband's treatments and procedures since the 4th of April 2023 have been to treat what is now seen as an autoimmune condition and secondary to the COVID-19 vaccine. In fact, his medical condition has been classified as painful trigeminal sensory neuropathy, secondary to the COVID vaccine, with clinical features of small fibre neuropathy. This is what is quoted on all his clinical letters. For Larry's medical team, there is no doubt that the COVID-19 vaccine caused his unimaginable pain and has ruined his life. I could stand here and talk for a very long time about all of the different treatments, medicines, scans, IV prednisolone, immunoglobulin infusions, and even Botox injections that have been tried and tested unsuccessfully on my husband since then. What you need to know is the facial pain, which began in his right trigeminal nerve in December 21, has now developed into chronic neuropathy along with small fibre neuropathy that has riddled his entire body, making him disabled and ruining his life. He went from being a perfectly fit, healthy and strong man who ran 10 kilometres most days. He played in a successful band and is known in the music community as one of the most talented guitar players. He wrote, produced, performed an album. He will never be able to sing again. And playing his beloved guitars causes him so much pain. He had a job as a college lecturer, which he loved. He helped multiple students achieve their dreams and has received countless letters of thanks to their favourite teacher. In their words, they wouldn't be where they are without him. Larry is now retired on ill health due to the vaccine injury and will never work again. He's never been sick in his life. He hasn't had a night's sleep in almost 3 years. He cries and screams in pain every night. He's fatigued from the lack of sleep. He struggles with basic tasks such as getting dressed, climbing stairs. He can't sit or lie in the same position for more than 25 to 30 minutes without serious pain. I know he's in serious pain right now. He needs to wear dark glasses, light sensitivity glasses indoors and out, but even these are not enough to stop the attacks of pain in his eyes. He can't go out anywhere without this awful face mask because the light sensitivity and the change of temperature and wind just sets off multiple attacks. He's crippled with chronic facial, leg, arm and lumbar pains 24/7 without a minute's peace. We've had to sell our family home. Once an accomplished, inspirational and renowned guitarist, producer, public artist and educator, Larry will no longer have the capacity to work again in the music industry. His music career has been taken away from him, and the progressive nature of Larry's vaccine injury has destroyed his and my mental health as we worry about what the future holds for us as he continues to deteriorate. He's tried every medication and treatment available to him, both on and off label. Nothing's working. He's getting worse every day. We are the unfortunate victims of Pfizer vaccine, and we are here today to plead for some kind of support, not only for us, but for all the vaccine injured and bereaved. We need help desperately, but in order to help us, the government needs to help the NHS. We've had a very positive experience with doctors and consultants in that they believed us and treated Larry for a vaccine injury. And Larry and I are extremely grateful to them for trying their hardest to help, but we know there are other vaccine injured that have not had that same experience. But they are very limited in their resources that are available to them, and there is still the fear to talk about the vaccine injured. This has to stop. We are not interested in anything, only looking for help. What is done. Yes, there are lessons to be learned big time. But for the vaccine injured, all we need is for them to be believed and be treated. We need to look at the medical, emotional and financial issues. We need to provide clear government guidelines for adverse reactions to the vaccines. We need a dedicated clinic in Northern Ireland for treating those affected by vaccine injuries and provide a care package. We need training for those in contact with vaccine injured, a dedicated research team to discover the nature of the adverse reactions. We need approval to try off-label treatments that have shown positive results in other areas. This is something that could be delivered quite quickly and inexpensively. We need financial help to reduce the criteria for the vaccine damage payment, and we need funding for experimental testing and treatment of the vaccine injured. The emotional stigma. Let's end the awful stigma attached to the vaccine injured. It's hard enough to deal with life-changing injuries, but having to deal with negativity and discriminatory comments towards the vaccine injured is just cruel. We need to raise awareness. I'll leave you with this thought. Put yourself in his position. My husband is trapped in a prison of his own body, unable to escape an unbearable pain. Could you cope with the constant, excruciating pain every second of the day and night? Imagine the pain of a raw nerve from a toothache, but in all of your teeth that would never go away. Add that raw pain, nerve pain, into every part of your head and body, and throw in electric shock attacks 30 to 4 times a day. Then imagine a clamp on your head 24/7. Oh, don't forget the severe light sensitivity and piercing pain in your eyes. Then forget about ever being able to eat, drink, talk, move any part of your face or body ever again without pain. On top of that, you will never be able to feel half of your face again. All this, and it's still deteriorating, and we don't know when it's going to stop, if ever. We feel like we are living through a constant wake. It's that awful feeling in the pit of your stomach, grief and complete sadness. It's beyond cruel. We were told the side effects were a sore arm, feeling tired, mild flu-like symptoms, headaches, muscle pain, joint pain, nausea. But you will feel better within a week, they said. It's almost 3 years now.
Thank you, Virginia and Larry, for sharing what's happened to you. I think I can speak for everyone and say that's an unbelievable set of events, and all our hearts are with you, Larry, for sure. We'll come up in a moment, and I know you have some slides as well you'd like to share as well, so I'll just set the first slide. Thank you, Justin.
Thank you to everybody that has come along today. I just wanted to show this, firstly, as this was to be a COVID passport. And on this, it states the second Pfizer COVID vaccine I got was on the 22nd of May 22. 5 days later, I took Bell's palsy. I was rushed in to resus, thinking I was taking a stroke. I had a brain scan done. Thankfully, it was only Bell's palsy. Shortly after that, which was the 20th of June 22, I took shingles all over my face and in my lymph nodes. I then had come out in this pustular rash, which is still ongoing. I then, on the 8th of December 22, was diagnosed with high blood pressure. I'm on medication now for life for it. I still have high blood pressure. I may need more medication. In between times, I have had numerous different infections, chronic sinusitis being one of them. This is the way my face has been on numerous occasions. I have sat in A&E for 16, 17, 18 hours at a time to be told I wasn't a priority. ENT wouldn't see me, I wasn't a priority. So 9 weeks of severe sinusitis and approximately 9 antibiotics still continued. I was then offered an emergency ENT appointment 2 weeks later, which was the 25th of May 23. I was admitted to the ENT ward and I was kept in over the full weekend. But on the first night, I went into full-blown anaphylactic shock with an antibiotic that I have had previously prior to the vaccine. This was coamoxiclav. I was then sent home 2 days later, but I had a severe pain in my right arm, which ended up swelling. And here you can see in these photographs, this is where the IV drip was. I was rushed then to the Royal Victoria Hospital. It turned out to be cellulitis and right brachial blood clot. I'm still experiencing quite a lot of these symptoms on a regular basis. As well as that, I have been seen by psychiatry. I have now been diagnosed with mood subjectively low and anxiety with multiple stressors, i.e. physical health. And another thing being social stressors. These social stressors being told we needed these vaccines. We needed them. It was for your own good. You needed to get them. This is all social stressors that have actually really affected me mentally. My physical health is still on a downward spiral. My hemoglobin level is very low and has been from the vaccine, and it has been noted with dermatology that the vaccine was the beginning of all of my health ailments. That was noted on the 16th of February this year. I have since had sinusitis again. I am always extremely breathless. I couldn't walk 2 meters without needing to sit down. As well as that, on the 1st of April this year, I was admitted to the hospital with myocarditis and pericarditis. I struggle with that still. Then on the 20th, I actually just forgot to put this up, just showing the myocarditis and pericarditis. And this is actually where I had to lie. This is me on different nebulizers and oxygen. And as well as another man had pointed out earlier, his legs swelling constantly. I am like this as well. On the 20th of June 24, I was then rushed down to the Royal Victoria Hospital again with mastoiditis, which is an infection in the mastoid gland in behind the ear. This was severely agonising, so that meant more antibiotics. And on the 4th of September 24, I then was diagnosed with parotitis, which is another infection in the gland here in the jawline. As I say, everything is still ongoing. I just don't seem to get a minute. I am fed up with being in hospital. I am fed up going into doctors and not being listened to. I am fed up just not even on a daily basis, on an hourly basis, because I don't know how I'm going to be. And it not only saddens me for myself, my whole family, but my 2 children. My 2 children now both have to attend CAMS, Children's Mental Health Services. I have just there last week had to get my 7-year-old into Children's Mental Health Services, and it's because they think their mummy is going to die. I can't go to the toilet without them following me, because they think if they leave my side, I'm not going to be here. They have had to see their mum just going downhill all of the time. And if they see me for 1 hour in bed, they're petrified. They are petrified. And I just believe now that I'm not on my own. I am not on my own, and I have felt like I have had to be on my own from I got my 2nd vaccine. And it seems to be the 2nd vaccine that has caused an awful lot of problems to an awful lot of people. And a lot that we don't know about, that are too afraid to come out and speak. I am not a public speaker at all. I wouldn't be able to speak in front of 3 people without stuttering and stammering, but something today is giving me the confidence and the courage to speak out. And I believe it's because many other people need to hear our stories, so that many other people I want more people to come forward and be able to open up and tell us exactly what they have went through. Because Vibs and I, the whole group, and I think it was Paul Frew had mentioned earlier, we are a community and we're here to help each other. And last picture, this is the person I want to get back to. That was me just before I got my second vaccine. I have put on a lot of weight due to steroids, medication and different things, and I just feel that it's the government's job now to get me back to that girl. Thank you.
Thank you, Justine. I think that's the third time I've heard you give your account, and each time's been outstanding, including at the Executive Office, where you shared with others to the First and Deputy First Minister. So it's very valuable what you're doing, and thank you again. Just a couple of things just before the break. I did see this morning, very early in the morning, I was still up, as in late night or early morning, that Larry Lowe, who's had to go home now because he's obviously not feeling so well with Virginia, but BBC actually have an article on his. It was actually the top story on BBC ANI, so it's something you might like to share out, read it, and spread the word. Very important. Supposed to have now another one of our community who's vaccine injured, Kathy Gault, come to speak, but I believe Kathy's not well enough today to come, so I believe instead we have Sharon, who's part of our committee, who will speak on her behalf. Thank you, Sharon.
As Jonathan said, Kathy was hoping to be here today, and she phoned me this morning quite distressed. She was too unwell, and so I offered to speak on her behalf, and she has sent me her statement, so I'm just going to literally read it out for Kathy. Kathy says, I was a fit and healthy and active mum to 2 boys. In March 2021, I went for my COVID Pfizer vaccination, and I suffered an adverse reaction that caused me a hyperimmune response. We've heard that before this afternoon. This caused multi-system dysregulation. I have developed mast cell activation syndrome, autonomic nervous system dysfunction, neuropathy, pudendal nerve neuralgia, continence issues, tinnitus. I am sensitive to light and sound. The list goes on. There was no clinical pathway or support set up for people who had suffered an adverse reaction to our COVID vaccinations. I cannot put into words how traumatic this has been, and the censorship of this all has caused so much suffering. I feel like I am living in a subsection of society. I have, these last few years, like many others, had to seek private treatment with consultants outside of Northern Ireland who are treating vaccine-injured patients privately. I've been to both England and the south of Ireland. I have put my family in debt. The science behind COVID vaccination injuries may be new, but it is available. There are many reputable research papers published, and research is ongoing and happening in other countries. People in other countries get access to treatments for vaccine damage that we in Northern Ireland are unable to. The science is also new and ongoing in relation to long COVID. However, our government did respond to people suffering from long COVID, and clinics were quickly set up to support these people. People with long COVID are not deemed misinformation. There needs to be the environment created to support medical professionals and give them a clinical pathway for patients with a suspected adverse reaction to their COVID vaccination to be referred on for assessment, research, monitoring, treatment and support. I feel frightened regarding what this vaccine has done to my body and is currently doing. I ask here today to anyone who can politically advocate, put yourself in the position of the vaccine injured. Put yourself in my position. How would you feel if you were us? If this had happened to you or even one of your loved ones, what would you expect your government to do?
So, as you can see, some of our folks who are vaccine injured either couldn't be here, even though they're intending to be, or have had to leave early. The next speaker was going to be Fiona Campbell from the Irish CV group, Irish CV clan, but she's also had to go back. She herself is actually vaccine injured as well, so she unfortunately won't be able to speak. But next, I would like to welcome our specialist diagnostic pathologist. I hope I got this right. Very honoured to have with us today Dr. Claire Craig to share some words. Thank you.
Thank you very much for inviting me. We shouldn't have to be here. And the people who've organised this, including people who were injured themselves or bereaved and have had to be fighting and fighting for their voices to be heard, shouldn't have to be doing that fight and shouldn't have to be doing that campaign. And those people that we've heard speak today with their utterly heart-wrenching stories, they shouldn't have to be exposing these incredibly personal stories, breaching their own medical confidentiality. And I'm just very, very grateful to them all for doing that. I want to say a quick word about the word vaccine itself. Vaccine is a very, very powerful word. We think of them as modern medical miracles. And so when people are told they're safe and effective, it's very easy for them to believe that. And I think it's incredibly important that we get over that. People need to drop this belief system and just treat this as any other drug. It's a drug. All drugs can cause harm. And I just want to talk a little bit about how we got here. You know, how did we get to this position? None of this should have happened. So, first of all, if you have a trial like the Pfizer trial, with that number of people in it, and there were, hypothetically, 1 in 4,000 people died because of the vaccine in that trial, that would not have reached statistical significance. So even a trial that was really quite a big trial can't tell you about safety issues. And so what you can tell people at the end of a trial like that is, there is uncertainty, and we can even put a number on how much uncertainty. You know, if it causes death to that degree, we just wouldn't know. And yet that was never done. It was presented as if it was completely safe. Worse, within the trials, when people were injured, those injuries were hidden. So the pharma companies would say that somebody who'd been injured had had COVID but no positive test. And because it had no positive test, that meant it wouldn't count towards the COVID numbers, but didn't count as an adverse reaction. And some of the other adverse reactions were hidden by them trying to dig into people's medical history and blame it on a condition that they already had, as if that's of any relevance. In a controlled trial, you should just be comparing the two groups regardless of medical history. Now, what's critical to understand about this particular product, or these particular products, is that they have actions that are global across the body. And our regulators have a system for monitoring safety which is designed to pick up single conditions that are rare, that increase in incidence. And so those systems picked up myocarditis and they picked up the rare brain clots. But they don't have systems in place for the kinds of problems we've seen, which are much more generalised across the body. And there's a reason that they're generalised across the body. So we know these things cause vascular harm, and that includes to the very, very small vessels that supply the nerves. And so that's why you get the autonomic nervous damage. It's why you get the pain problems, and so the neurological problems in general. We know that there were contaminants like the cell walls of bacteria, which were from these huge vats they used to manufacture the products. And those endotoxins from bacteria are known to cause all sorts of pathology across the body. And if the levels are too high, you're going to get all sorts of pathology. We know that the lipid nanoparticles are toxic across the body. And then, as Mike was saying, when you've got proteins being produced in organs across the body, and those cells are then destroyed, that means you can damage any organ in the body. And so if you think about somebody who's got 2 kidneys, and they might have a problem with 1 kidney, and so they've got a spare. And we've got spare tissue in all of our organs. But if you destroy that spare healthy tissue, you can reveal underlying problems that would never have come to the surface if you hadn't destroyed that healthy cellular reserve. We've also know that these products had a problem called frame shifting. But what that meant in the real world is that proteins are produced that weren't spike protein. There were all sorts of different potential proteins being produced that haven't been measured because we don't know what they are, so we don't know how to test for them. And so we don't know what they do. So they could also cause all sorts of problems. So we have to take we've also got the immune problems, of course, that we've heard of a lot today. So you have to take a bigger picture view of the total harm. And, when you hear all the stories that we've heard today, and you're obviously all familiar with them in this room, there is a vaccine injury syndrome where you can absolutely see overlap between these problems in certain people. And we've had no way of measuring that syndrome. Each condition has been put into the data in a different place. But we can tell you that there's been a massive problem with people being too sick to work. So the working age population, 2% of them are no longer able to work because they're long-term sick. So this is a huge problem, and that the rise in that sickness happened in spring 2021. It had not happened before that date. We also have this problem with the regulator where they believe vaccines can only cause harm in the first couple of weeks after injection. And that's just simply not true. And they also believe that they don't start working until a few weeks afterwards. So if you've got an immune problem, that's total nonsense to say they couldn't cause harm later. And the swine flu vaccine pandemics caused narcolepsy, which is a brain damage to the sleep centres. The time between injection and diagnosis was 8 months. But the thing is, once you've built in a time lag between injection and a problem, then people start to not notice that they don't make the link, they just don't make the connection. And that's a really big problem. We also have a problem with medical coding. So one condition can get coded in all sorts of different ways. For instance, I think a lot of vaccine-injured people, some with palpitations, others with neurological problems, have been told they have anxiety. And so these have gone into the system as anxiety codes. And so when you look at this long-term sickness in the 2%, a lot of that is coded as anxiety. But that word anxiety is hiding a whole lot of different harm. We also have a problem that doctors won't write it into the notes. People have doctors who agree with them that this is a problem, and it's not recorded in the notes. And we know very well that people who have died have not had it put on death certificates, that coroners aren't prepared to make a stand, they lack in courage. And so you can't get safety monitoring data when the data isn't being collected properly, and that's the fundamental problem that we have here. And it's such a contrast to COVID, isn't it? Anyone with a COVID positive test, any symptom afterwards was COVID, any hospitalisation afterwards was COVID, any death was COVID. And if you had a vaccine, the only symptoms you're allowed are a sore arm, but that's about it. And then any hospitalisation is not relevant, and any death is a coincidence. And both of them are nonsense. Both ways are totally unscientific. And so the final problem is to say with the regulator is that they have throughout of this period kept referring back to risks being outweighed by the benefits. And the benefits of these products are a fantasy based on modelling with unreasonable assumptions. It's a faith-based benefit system. And they have ignored different risk groups, and they have completely ignored informed consent. And so I think the ultimate damage caused by these vaccines has been a damage to medical ethics. And so I think what's critical at this time in Northern Ireland is that we're here talking about what happens when people are manipulated through fear and coerced into getting vaccines that they did not need and being injured as a result, at a time when a bill is being proposed to say that bodily autonomy should be overwritten and that the state has control of what goes into your body, which is that's the end of medical ethics as we know it. And I think we all need to make a stand on that bill as well as on the vaccine bill.
Thank you, Dr. Claire Craig. So we're coming towards the end of our time. I think we just have a couple more agenda items, one of which I believe is Q&A. We have a couple of roving microphones. We have Darren and Sharon from VIBS, also myself, and if Dr. Claire Craig is around for a few more minutes, if you have any questions on that side. There's a few other doctors around today as well who might be able to help with any medical questions. So I don't know if there's any, we can do maybe hands up if there are any sort of questions, and one of us can run a microphone down and we can get the speaker to respond at the front here. So if you have a question, feel free to put your hand up. And questions on the vaccines or on the health side or anything to do with the yellow card scheme, things like that.
Yes, it's just a question about shedding. If anyone has any information on that, because there's a lot of stuff going around the interweb. Do people shed? Can you catch it if you don't? If you haven't taken the vaccine, etc.
That's always a tricky one to answer because it's a big unknown. But the way that the lipid nanoparticles get into a cell is not just drifting in. People often talk about it as if they're just floating through cell membranes. They're actively taken up into cells. So getting out of a cell again isn't that obvious. Like, how are they getting out and still being surrounded by membrane and able to go anywhere? So that's a bit of a missing link in the theory behind it, because most people seem to think if they're drifting in and out of cells, they can drift out of the cells everywhere. There isn't really evidence that they can. There is, of course, hypothetical, they haven't proven it can't, right? We don't have proof that it can't, and that's a problem. And we've seen that the pharmaceutical companies have were worried about it in their trials, telling people not to have close contact if they were going to conceive and that sort of thing. So I think it's a hypothetical unknown. There's a lot of unknowns about these products. That's the truth. There's a lot of unknowns, and that should, the idea that we've vaccinated this many billions of people there's so much unknown is just utterly unethical.
Just one more question while you're there, because I can't. Can you sing and dance while you're up there? Just one more question, sorry about that. Is there a blood test that people can get? Because it wouldn't be too wise going to your GP, considering they're the ones that are given the vaccines in the first place. So, for the nanoparticles and stuff like that, if you have a worry about it, if you've taken it up or you've taken, you have side effects or whatever, is there a test that you can do to see if you have these nanoparticles or not?
So if you had been injected a while ago, the idea that the lipid nanoparticles would still be a problem now, I don't think that would be the case. Your body would have just metabolized them by now. But if you, we do know that vaccinated people continue to produce spike protein for a long, long time. And you can do a surrogate marker for that. So you can do a blood test for the spike antibodies. And, you can see some people who've got massive amounts of antibodies, which you just don't have antibodies at that higher level unless there's a protein around for them to be actively binding to. So that's a surrogate marker for it that you can get really very easily, that test. And what the real problem is that the NHS isn't looking at these problems, and so we don't have the testing system set up to find out more. And the test that's really fundamental that's missing is a tissue-based test for spike in the pathology lab, so that when you do a post-mortem, you can't get all the information you need because you can't look for spike. And when you've got somebody where there's a question in a cancer, say, if you can't look for spike in the cancer tissue, then you can't answer all the questions. And so that isn't a test that should be really difficult to set up. It's just that there suddenly seems to be a lot of barriers to doing it.
I think we've got time for just a couple more questions. So, yeah, yourself is next.
Hi. I was actually here. I'm representing the sister, but I also took 2 vaccines. I have asked doctors a lot of questions because of my conditions. I was brought into hospital there about 2 months ago, ectopic heart beats. Right? Now, again, I have asked the consultant, I've asked quite a number of doctors, can this be due to vaccines? Is it possible?
So
Or has it been said that it can happen?
What's really, really challenging with all of this is that if you prove on a population level that the vaccines have caused, say, increased arrhythmias in the heart, which we can prove, that doesn't make it easier on an individual level. And that's the real challenge, because arrhythmias are common. So in any one person, how do you know they weren't going to get that anyway? And how do you know if it's a vaccine? But we do know that rhythm problems absolutely have been caused by these vaccines. And the Pfizer's latest safety report showed that in every single one of their databases, there was a big signal for heart arrhythmias. And if you look at the heart conditions as a whole, so they've broken it down into, heart rhythm problems, acute cardiac events, myocarditis, it's all separated into different categories. But if you look at all the cardiac problems, then into the databases, it's around 1 in 300 people had a cardiac problem after their doses in those data sets. And we know that the cardiac waiting lists are now 2 years long, right? So it all kind of fits together. But that's the whole problem, is that if you're looking just at one condition, you're not seeing the heart conditions as a whole. You need to look at it as a whole. And if you're looking at one person, it's very hard to tell them for sure whether or not that was the risk to them.
We only have time.
A question and also a comment. The comment is, we have a friend, my wife and I have a friend, and the question from the floor was, is there shedding? And I can absolutely assure everyone here that there is shedding. How? Our doctor friend here could probably tell us. But this particular girl, a friend of ours, her husband is really into his vaccines. Every vaccine that goes, he gets it. And they have found that she has found that she has to sleep in a separate room to him, otherwise she feels ill. If she travels anywhere in the car with him, after a while she feels ill. But yet when she is on her own, she's absolutely fine. So all I can do is assure everyone here that there is shedding of some form of description. The other point that I want to make is, I'm over 70, all right? Still feel as if I'm 21. That's, you're supposed to laugh. Anyhow, the point I'm trying to make is, my wife and I have just been asked to have another COVID vaccine. Now, our doctor's surgery must know that we haven't even had the first one. So what vaccine are they going to give us? But this has come to me. I think I've now had at least 10 invitations to have a vaccine. And I want to say to Mike Nesbitt here today, he is a total and utter disgrace if he does not stop this. Michael McBride and Robin Swan, who pushed this through in the first place, these two individuals should be prosecuted for genocide. In this country, our little country of Northern Ireland. This gentleman here, 27 years of age. My heart goes out to people like this. Why are we allowing this to happen? And why are we allowing it to continue? Right, maybe I've said too much. Thank you.